The following segment is paid for by Florida E.N.T.
Welcome to Healthcare Champions. I'm Shelley Sanders. Today we're talking all about the ear, nose, and throat. Can't think of a better person to talk to about it than Dr. Scott Powell. You're with Florida E.N.T. and Allergy. Welcome to the show.
Thank you for having me.
It's so nice to have you here because this is Florida. We have just an insane amount of allergies all year long. It seems like once one season, allergy season goes away, it's only bringing about another one. And I'm preaching to the choir right now. Let's talk about it. First of all, before we go there, let's talk about you and the practice. How many locations do you have here in the Bay Area?
We have 13 offices and nearly 25 physicians.
Wow, that's incredible. 13 offices, and they range in, what, 3-4 counties?
Yeah, Pinellas, Hillsborough, Pasco, we're the whole Bay Area.
So basically, if you're in these areas, if you're watching the show, you've got an office.
You've got an office nearby.
Basically.
Right. Yeah.
All right, so let's talk about, there's so many things I want to go to, so many topics we could talk about, but let's talk about pediatrics. Pediatric problems when it comes to the ear, nose, and throat. I know I'm a mother. This was a hot button for us. And then what's the difference between that and, say, adults and how that differs?
Well, the pediatric population, we like to think of it, they're not just little adults.
Right.
They have very unique problems. A lot of it is not their own doing. And part of it is just they haven't grown enough yet. So, for example, ear infections, their skull size is a little bit small, so they haven't grown into their own anatomy. A lot of kids now in this day and age go to daycares, go to group areas for daycare type situations, and they're exposed to a lot of things. That's not a bad thing, it's just their body's not yet set to handle that.
Sure, as opposed to an adult that can fight that off a little easier.
Adults is somewhat self-inflicted, unfortunately, and sometimes it's just more of a chronic problem.
Sure, and so what are those problems?
So in the adult population, for example, sometimes chronic allergy, they've had their whole life of infection, their whole life of allergies. Sometimes patients are smokers. It's a habit that people have and they deal with it. Other times it's just situations where they have, head and neck cancers of the world. So there are much different realms when you talk about the adult world than we talk about the pediatrics.
I think it's important to note, though, it's nice to know that you guys do treat pediatrics as well. So when we're talking about that, those issues that children have, what are some of those? Obviously the ear infections and the ear, I understand, is different in an adult versus a child, but what are they and how do you go about treating a child versus a full-grown adult? Right.
Well, yeah, our board certification is from newborns all the way on, so that's our special training. So for the pediatric world, a lot of we'll call it the bread and butter, are a lot of the ear infections. So a lot of times they need chronic infections, they need ear tubes, and they need ear tubes essentially are designed to stay in place long enough for them to grow out of their problem and the ear tubes fall out.
Sure.
And they are happy thereafter. Tonsil infections, adenoid infections, those are another big hot button topic because you have snoring, you have sleep apnea, chronic sore throats, chronic sinusitis. All those things are just so much swollen tissue, not yet quite big enough head.
Sure. Now, I know when I was growing up, it seemed like everyone was having their tonsils taken out. Is that as much of a thing now as it was maybe 20 years ago?
Luckily, we've got a little more science behind it. So the pendulum swung from no one, or everyone had them pulled out to no one, and now we're somewhere in the middle where there's certain criteria that we want to keep them in there. Part of the situation, again, is if they're exposed to a lot of infections, these infections can get away from them and they require intervention.
Sure. Now, do you have advice for, say, parents out there when it comes to, say, you have a child that is prone to ear infections? Is there any advice or tips that you can give them on that? Because it's so difficult. Certainly if you've got a child that goes to preschool, I mean, they just don't wash their hands like we would as an adult. So any tips you can offer parents? If
you can control their allergies to a good amount, that will help a lot. A lot of it is, with the really young children who have ear infections, they don't want to be feeding on the bottle lying flat. You want to prop them up. You want to have the ability for their ears essentially to stay above their nose or in their mouth. That allows gravity to get them some help. A lot of it is just living through it, and so don't treat every single infection with an antibiotic. Sometimes a cold is just going to be a cold.
Let it run its course.
My favorite thing are saline sprays. My kids run when they hear sniff. I'm coming at them with saline. So.
You heard that from Dr. Powell himself. I love that. All right, so that being said, you offer so many things in the clinic too, which is a big plus, certainly for me personally. I love that aspect. Tell our viewers real quick, when it comes to treatment or even diagnosis, you have all the capabilities of diagnosing things right there in the office, right?
Yeah, so patients have issues, they have time, the parents have a difficult time with all their kids, so we try to get everything in one location as best we can.
Perfect.
So we offer allergy testing for the pediatrics, and food allergy testing for the pediatric world is very hot topic right now.
Sure.
We do offer, if it gets to that point, we do offer the ability for CAT scans, and our CAT scans are lower radiation, which is a really big deal than the average CAT scan, so that's a big deal as well.
Yeah.
And then if even needed beyond that, we do offer voice evaluations and so forth. So we try to keep everything in one roof because patients have better things to do with their time.
Amen. All right, so I know they're wanting to know, we probably have parents out there right now going, oh my gosh, I need to contact you. How do they do that?
Probably the easiest way is our website. It's Florida E.N.T and allergy.com, and then from there they can find all of us, call the phone number and get an appointment.
So out of 13 different locations, and that's Florida E.N.T, and spell that "and" out, Florida E.N.T, A-N-D, allergy.com.
The preceding segment was paid for by Florida E.N.T. Stop sneezing? Having issues with your throat? Sinus problems? Florida E.N.T and Allergy is here to help you. We have a great team of medical professionals and 25 physicians on staff delivering superior care, one patient at a time. We've been serving Tampa Bay residents for 40 years. From pediatric allergies to fitting hearing aids, our physicians use cutting-edge technologies to provide specialized ear, nose, and throat care for the entire family. Florida E.N.T and Allergy, here to help you and your family.